This is KPFT Houston, 90.1 FM and FM HD1.
I'm your host, Ayla Dehghanpoor with Houston Food Bank. And joining us today, we have Josh Brown, Chief Executive Officer of Fort Bend Women's Center, and Dan Gordon, Executive Director of Gordon Education. First up this morning, we're speaking with Josh Brown, Chief Executive Officer of Fort Bend Women's Center, to talk about domestic violence, survivor support systems, and gaps in long-term recovery. Josh, good morning and welcome.
Good morning. Thank you for having me.
I'm so glad you're here. So why don't we jump right into it, this very important topic. So as CEO of Fort Bend Women's Center, what are you seeing right now in terms of demand for services and the needs of survivors?
Well, I think it's going up. As we all kind of know in this area, there's been some hyper growth. And as Fort Bend County grows, as the greater Houston area grows, the need for services also increases. To put some numbers to that, back in 2020, Fort Bend Women's Center served 1,758 individuals. Just last year in 2025, we served 4,057. So that's a combination of growth in the county and us being a little bit more proactive about helping and seeking those that need help.
Yeah. And so the organization provides everything from emergency shelter to long-term support. So why is it important to approach recovery as a continuum rather than one single intervention?
That's a great question. The reason is because with this type of trauma, the reality is one size does not fit all. The people are different and they have different needs. They're at different places in their journey and their recovery. So it's important to have different tools when you're talking about individualized treatment and individualized trauma treatment in particular.
Yeah. And so in this treatment and in, the work that you do, many people think of domestic violence as a private issue. So how do you see it functioning as a broader community or public health issue?
They do indeed. And that's sort of a misconception that people have that it should be private and it should stay private. But the reality is this type of domestic violence, this type of abuse, it affects all facets of society. Everything from law enforcement who have to respond to these very dangerous calls to the medical field. But it also affects us economically. When you have someone in an abusive situation, the increase in absenteeism from work, the decrease in productivity, it begins to affect really every side of our society.
Yeah. And so talking about all of those factors and the way that this affects, the whole community, and especially the survivors in all these different ways. So often when survivors leave crisis situations, they have very limited resources, right? And so what are the biggest barriers that they face in those first critical days after leaving?
So it's individualized, but a big barrier for most survivors that we see is just confusion. Is what do I do? Where do I go? I now have to interact with systems that maybe I've never had to interact with. And for those that come to us, they have someone to help guide them through that. But for those that aren't connecting with service providers, they may be very, very confused about how do I get a job? How do I get my kids re-enrolled in school? It's varied, and I think the confusion is the big barrier.
Yeah. And so, speaking of interacting with systems that maybe they've never had to interact with before, your services do include counseling, legal advocacy, case management, again, systems that most of us have never had to deal with before. So how do those pieces work together to help someone to move towards stability?
So I think it's very important to have a case manager. Case manager is someone that can walk beside you and figure out what your needs are and where you'd like to go, and then help you, point you in the right direction, link you up with the right resources. And with counseling, in mental health treatment, if you can stabilize emotionally and from a mental health perspective, you're much more likely to be able to, say, get a job and keep a job, earn money for rent, that sort of thing. And then from the legal standpoint, again, that's a very complex system that many people have not had to get into in depth. And so having legal support works together, because if you're being drugged down by legal issues, it's really hard to stabilize emotionally. It's really hard to figure out where you want to go.
Yeah. And so you mentioned this a little bit already, but, in speaking towards, getting a job, right? And all of the financial stress that comes with this. A large percentage of the individuals that you serve are living at or below the poverty level. So how does financial instability intersect with someone's ability to leave or recover from abuse?
That plays a huge role. One of the areas that abusers use is financial abuse. So making sure that the person they're abusing does not have a job, does not have those work skills, so that if someone doesn't have control of the money and doesn't have skills to make money, or has not been able to do that, leaving is a very frightening, beyond the physical safety, beyond all of that. It's a very frightening prospect, particularly if you've got children, if you've got people counting on you. If you're financially unstable, what do you do? Where do you go? How do you get a job? How do you afford a place to live? So that's a big, plays very large into people's decisions to leave.
Yeah. And so the organization does also operate a 24-hour crisis hotline. So what role does that immediate access to support play in preventing further harm?
So that's huge, because not everybody's ready to leave. It's not safe necessarily for someone to leave at a certain point. There's a preparation that has to happen. So having a 24-hour crisis line that you can call and ask questions, to get safety planning, to even figure out what's out there. Because again, a lot of people haven't had to deal in these systems before. So you may know that you're in an abusive relationship. You may want to leave, but you have no idea what to do or where to go. So having someone you can call to say, hey, what's out there? What should I do? What can I do in these situations is very critical, even if it's just answer a question, not even to make a movement toward leaving.
Yeah. And so in that planning part that happens, and of course, afterwards, once they are, have come to you for services or managed to get out, there's another piece to it that makes it even more complex, which is that many survivors are also caring for children. So how does that change both the urgency and, again, the complexity of the support that they need throughout the whole process?
It becomes hugely complex. If it's you, it's complex enough. But then if you have children that you have to care for and figure out, many times abusers will use the children or the threat of custody and things like that to keep control over the person they're abusing. But children, they may not be the primary victim in the abusive situation, but they sure are a secondary victim, and they see it and they hear it and they feel it. So they're affected as well. So with some parents that we see, there's a feeling, you talk about complex, there's a feeling of guilt that they've had their children in this situation. So not only are you dealing with the logistics of trying to get children out of a situation and yourself, and trying to figure out how do I get them into school? Where do I go? I've got to uproot them from their family life, got to uproot them from their friends. But then you also have you can have your own guilt about, wow, I had them in this situation.
Yeah. And so, guilt, I think, is one piece of this, but there's a lot that goes into that long-term recovery. And so that often also involves rebuilding housing, employment, emotional stability. So where do the current systems that are in place tend to fall short in supporting that process?
So I think, affordable housing is always a big thing. It's a big thing for everybody, but particularly those that, again, we talk about financial instability due to abuse. Those that are getting out of abusive situations that are not financially stable. If there's not affordable housing, where do you go? And if you have children, where do you go? And there are shelters, there are places to go, but again, we're growing very rapidly in this area, and beds are not always that plentiful. So I think affordable housing is huge. I think the transportation systems, if you don't have a car, particularly in the greater Houston area, if you don't have a vehicle, it's a little bit harder to move around. Out in Fort Bend County, same thing. It's a little bit harder to move around. So I think those areas are the big sort of logistical areas where we may not have as much support as is needed.
Yeah. And, there is also often a misconception that leaving an abusive situation resolves the issue, right? You're out, you did it. But what realities do survivors face after they leave that people maybe don't always see?
So you're exactly right. That's a misconception that people say, well, just leave and get out and everything will be fine. But the reality is that abuse can continue. What people don't see is the big things like the abuse continuing, the harassment, things of that nature. One of the big things that I think people don't realize is when someone leaves an abusive relationship is the isolation they can feel. And what I mean by that is that if they've been sort of sheltered and not allowed to have a social network, which is very common in abusive situations, then when you leave, you have no support system. And you may interact with these systems where you can get housing and you can get housing assistance, you get help. But then you're in an apartment, maybe in a place that you don't know anything about, in a part of town you're not unfamiliar with, you have not been allowed to have friends. So the reality is that isolation can lead to mental health issues, depression, loss of hope, things of that nature.
Yeah. And so, from your perspective, what structural changes would make the biggest difference in preventing domestic and sexual violence in the first place?
I think education and awareness is huge. Being able to acknowledge that this happens, that this is a pervasive thing in society. I'd say amazingly, it's really not that amazing, but amazingly, several of the survivors that we work with of domestic violence didn't really realize the extent of the abuse that was going on. Everyone thinks of physical abuse as the thing. But along with physical abuse comes emotional abuse, financial abuse, spiritual abuse. It can run the gamut. So I think society and systems understanding that and then putting together things to be able to respond to those types of traumas versus just the physical.
Yeah. And so, for listeners who want to support survivors and strengthen these systems in our community, what are some meaningful ways to get involved?
So I think if people want to get involved, I think it's great to find a local organization, a service provider that is working with domestic violence, and reach out to them. And it could be that you volunteer. It could be, and some people think of, I'm going to go and reorganize the food pantry in the shelter. And people might think, well, I'm not directly helping survivors, but you are. You're directly and indirectly helping survivors. You go in and you work in the office and you help with office work. You help we have retail stores, we have resale stores, Thriftwise. You can go in and sort clothing and help do that. And that takes that off of our staff. Most service providers are under-resourced and understaffed, just as the nature of the work that we do. And so helping the staff to prevent burnout is a huge thing that people can do and get involved. Of course, there's always getting involved in going out and helping us do outreach, coming to our events, starting a campaign at your work, at your place of employment, just talking to your HR department or your leadership and saying, hey, can we talk to our staff about domestic violence? Can we bring the Women's Center in? Can we bring other experts in to talk about this? That's huge. That, again, creates that awareness. And the more people that are aware of it, the more that we can do about it.
Amazing. Well, thank you so much, Josh, for being here with us and chatting and sharing all the amazing work that you do.
Absolutely. Thank you for having me. I really do appreciate it.